Namaste. I am myself Dr. Nithinpatel. I am one of the trustee member of this institute, Shivambu Health Research Institute. He is my father, Dr. Shashi Patil. Actually, he is being called as a Shivambu Maharshi. Since 1974, he is practicing urine therapy at Kolhapur, and he has uh, developed this therapy called as Shivambu therapy. Basically, he turned to this therapy by listening to one of the sage near to Kolhapur, that is Kadeshitweshwar Maharaj, and later on he practiced urine therapies for last 40 years. And then we have this Shivambu Health Research Institute, and through this we are running this Anand Kunj Naturopathy Yogashram. This is a 30-acre campus here. I am myself his son, elder son. One of my younger brother also, Dr. Sarang Patil, who is a BNYS graduate. Also, he has done a PhD in psychophysiology, and later on he has joined us, and we both brothers are working since last 25 years at this place. So we are practicing urine therapy along with the naturopathy and yoga. He is my son, Dr. Sandesh Patil. He has also completed BNYS and pursuing MD in naturopathy. At our place, this is, as I told, this is a 30-acre campus. With an integrative approach, we are practicing urine therapy along with naturopathy and yoga, and various diseases like from common cold to cancer, diabetes, blood pressure, heart disease, all types of patients. They do come from all over the world, and they pursue this therapy. They practice this therapy along with the naturopathy, and they get a very good result. Generally, the question you are asking me about the cancer patients, how we can treat with the urine therapy. Actually, if you see, there are various kinds of cancer. So generally, what we have seen in last 40 years is that in modern science, for cancer patients, there are various treatment, like there is a surgical correction or a chemotherapy or radiation. But with this, what is happening is you are treating only the symptom. You are not treating the cause of the disease, and because of that, again and again recurrence happens. Sometimes there are so many patients, they go for a surgery, they take a chemo, they get a relief for 6 to 9 months, 1 year, and then again there is a relapse of a disease. That's what we see in this world. So with the help of urine therapy, we treat cancers, various kinds of cancers very successfully. Why? Because urine therapy, with the help of urine therapy, you are treating the cause of the disease. Because cancer is such a disease, it's generally because of so much of accumulation of toxins in the body, and once these toxins are removed from the body, automatically cancer cells get vanished, or else they are rejuvenated. So what I say is, until and unless you don't change your diet, don't detoxify your body, you are not getting rid of the cancer. So with the help of urine therapy, you can get rid of your disease because you are treating the root cause of the disease. As I told you that ours is a charitable trust. So this is Shivambu Health Research Institute trust, and through which this Anand Kunj Holistic Health Home we are running. So what I'll appeal to cancer patients is, generally what we have seen is people go through the chemotherapy, radiation, all that, and whole family suffers. Economically they go down so much. So for them, I appeal them that you can come to our center at a very negligible amount. If you are poor, then with a very small amount you can treat yourself. There is no more expenses while practicing urine therapy, whereas in other therapies you spend so much of lakhs of rupees. So for them, I promise you that at our place, even suppose a person is very economically down, even a free treatment can be given at our center.
So as sir mentioned, we should eat more living kind of food. What is living kind of food? More of raw vegetables. What consists of raw vegetables? Carrots, cucumber, spinach, methi. You can all eat these things and then you can have your normal food. What you should do is take 2 plates. First plate you take all raw vegetables, beet, then cucumber, carrot, cabbage. You can take all these things. Then you can take one other plate where you can have your chapati and your sabji. First we'll go on the raw vegetable plate. First you finish all the raw vegetable plate. Okay.
Generally, in this, what we say is that 10% of your 10% grams of your weight. Suppose a person is weighing 50 kilos, he should eat once first in the morning that 500 grams of fruit combo. So all the fruits, citrus fruits, that mosami, santri, apple, banana, all this, there are new fruits, cherry or dragon fruit, everything should be, your plate should be colorful. So 10% grams of your total weight. Suppose a person is weighing 50 kilos, he should at least eat 500 grams of fruit. 60 kilos 600 grams, 70 kilos 700 grams. In the afternoon one should have a 5% grams of your of your weight vegetables. So all this carrot, spinach, methi leaves, all this should come. That is 5% of your this one. Means suppose a person is weighing 50 kilos, then at least 250 grams of vegetables, and over that you can have some boiled soup, vegetable soup, lens soup, like that. Some porridges you can have. But before that, what I mean to say is you need a lot of proteins and vitamins and minerals. So if though that goes in your diet, automatically healing will start. What you can do is the dry fruits, that kaju is there, badam is there, anjeer is there. You can soak it in a water, okay, and that soaked dry fruits you can use it in your diet. So the sprouts you can take. So in that sprout you can put that soaked dry fruits, some coconut finish you can put in that, some Nutella granules you can put in that, some dates you can put in that. If you're not diabetic, then you can put some jaggery in that, make a mixture, there is a good porridge, you can eat that. Okay, over that you can eat some shakes like anjeer and banana, badam and apple. You can use soaked badam, you can use it in an apple, mix it in a water and make a juice of that, which will be very helpful. So such a type of living food, once one if somebody takes, which will be very helpful. I generally prescribe to my patients in this way.